What's up, rookies? Welcome to another episode of Rotation Reflections. Today, I'm really excited to have Ryan, who is back on for the second time. Ryan is an amazing friend and colleague, and he is here to talk about his amazing, exciting, different compounding rotation at ScriptWorks. Ryan, welcome. How you doing?
Hi, Brigitte. Thanks again for having me on. I'm doing great. I'm glad that I get to talk to you again.
Yeah.
I'm excited for this.
Yeah, same here. And I would like to say I'm even more grateful that you're here on your birthday. Okay, so
Hey,
we're gonna have the whole rookie pharmacist crew say happy birthday to Ryan.
oh, I'm sure.
I
I'm
hope
sure. I'm sure.
I hope you have more fun after this, more fun than talking to me. So let's get started, okay? So tell us about you. You've been here before, but remind us why pharmacy and where are you right now on that journey?
Really wanted to go into pharmacy. Mainly it's a little cliche, but I helped manage my grandmother's medications when I was a child. She had diabetes, so she had a bunch of different things going on, and so just help managing that. I also had a skin condition, and so I was using like creams and ointments every single day to
Mm-hmm.
help treat that. So I was really interested in
Mm-hmm.
how that works. So that's why I chose pharmacy. But right now, graduating in May, in my
Oh,
fourth
yes.
year,
May 2023. I'll be
May
there
2023.
to support you. I'm so excited. It's been a long, long, windy road, but you've
Long journey.
been so good. And now you got how many rotations left then?
Well, I have 5 rotations left.
Okay, 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 okay. Hang in there.
But
And I have a feeling you'll be here to talk about each of those 5 rotations.
oh yeah, no, it'll be great. They're all really, really cool. I have both my AM cares and some really
Uh-huh.
cool electives in like the acute setting, so like in the ER and the ICU. So it'll be pretty cool.
Yeah, you did mention you have a lot of ICU rotations lined up, but
Yeah, yeah.
now let's talk about this compounding rotation. Was it
Mm.
an elective rotation or a required rotation? Where was it? Tell us about the facility and what was your schedule like, and just a general overview of the rotation.
Sure. So I was lucky enough to work for Bob Brencel. He's the owner of ScriptWorks Pharmacy in Walnut Creek.
Mm,
The facility is actually in Doctor's Park, so in Shadelands. So there are a lot of doctor's offices surrounding the pharmacy, which is really
okay.
nice because he can interact with those providers and get patient care in that regard. Parking's not too hard, but I was there from Monday through Friday, 9 to 5, for the most part.
Okay.
Um,
Okay. Pretty nice.
so
Mm-hmm.
it's a wonderful facility.
Okay.
It sticks with non-sterile compounding and they have, I think, 12 employees. There's
Okay.
like four
Okay.
or five pharmacists and then like 6 techs.
Okay. So it's an independently owned pharmacy and
Yes,
conveniently located amidst of several doctor's offices, because that's smart. That's where their patients would come, right? Right after their doctor's visits.
of
Um,
course.
you talked about the owner, you talked about the schedule, nine to
Hmm?
five.
Nine
Uh,
to five.
Okay, that gives us a good setup, a good visual of you being there. And now,
Mhm.
as a student, as a pharmacy student on rotations there, what were their expectations for you? What were your responsibilities and your learning experiences?
Of course. So, first week, it was really filling medications, seeing how well I could pick up their system.
Okay,
Some students go at their own pace, so I
okay,
was able to pick it up pretty well. And
okay.
then they tested my math skills because a
Yes,
lot of compounding is
yeah.
knowing when to use like a salt form of a medication and when to use the regular form. And you have to do conversions between them because they're not all equivalent. So
Okay,
just
okay,
learning how to calculate that
okay,
to get a proper dose for a patient was something
okay,
that I was in
okay,
charge of.
okay, okay.
If Bob had a clinical question from a doctor, I was
Mm-hmm.
also in charge of that.
Okay.
There was one clinical question where they were having trouble getting Wegovy for patients. And so it was
Oh,
my job to try to reach out to like Cardinal or McKesson or someone where we could have the Wegovy shipped to us so we could provide that for that patient. And
Okay.
we were able to do that and
Okay.
find a reasonable price to give it to the doctor so they could get it to the patient.
Okay. Okay. So compounding, filling prescriptions,
Hmm.
calculations. I'm glad you brought up calculations because it's every healthcare provider's kind of nightmare. And you did mention clinical questions. So
Yep.
it wasn't just a compounding pharmacy, right? Compounding is part of what they do in the pharmacy. Okay.
Hmm.
Yeah, and you talked about you experienced drug shortages too, because in this particular period, we're experiencing a lot of drug shortages for a lot of medications. Wegovy being one of them, Trulicity, a lot of oncology drugs. So you got to experience and learn about and learn how to work around a lot of that stuff. All right, and I'm so glad you mentioned calculations because that's kind of every healthcare provider, or maybe not healthcare provider, but every pharmacist and pharmacy technicians must know because we do a lot of calculations in our practice. But on for this specific rotation, what kind of calculations specifically are we talking about? Those conversions from like different forms of valproic acid, or are we talking about milligram per kilogram type of math, or conversions from grams to kilograms, or what? Can you be a little more specific for our students so they would know what to review in preparation for this rotation?
Of course. So you're definitely right. It's all sorts of conversions.
Mm.
Students
Okay.
should definitely be ready to convert from milligrams to kilograms
Yes.
to
Okay.
grams, all the conversions. They need to know that very, very quickly.
Okay.
The pharmacist that I worked with was actually Bob's son. He is
Okay.
a very astute pharmacist and knows his
Wow.
calculations. He can do it all in his head in a flash. So I had to really pick that up very quickly.
Okay.
He always asks like, "How good are you at math?" And I was like, like a 7 out of 10. He's like, okay, we'll see. I'm gonna test him. So he was very, very astute to that.
All
In
right.
addition, we would receive all of our compounding materials from PCCA, which is a pharmacy organization that
Okay.
provides very um, clean and
Like active.
potent ingredients. Yeah.
Mm-hmm.
And
Mm-hmm.
so they would give us actually a sheet, a production sheet of how, if it's a salt form versus the active ingredient, whether or not we need to use a conversion factor. And
Okay.
so
Okay.
when we take a look at that, we can use that conversion factor to actually see how much active form of an ingredient a patient's getting.
Got
Um,
you. Got you. Got you.
the pharmacy has over 10,000 different ways they compound different prescriptions. They have that many, what's the word I'm looking for? Like formulas for different things.
And the recipe.
Creams, ointments,
Mm-hmm. Mm-hmm.
it's a very, very large database. And
Okay.
so
Wow.
they're very keen on trying to find one thing that's good for a patient and help provide that for them.
Mm-hmm.
So
Mm-hmm.
um,
Mm-hmm.
that
Mm-hmm.
kind of helps with the calculation, but
Yeah.
uh, that that that's
Yeah,
essentially what you're doing here.
that's it. Yeah, because my next question was going to be what kind of resources do you use to keep up with the recipes and the calculations, but it's
Oh yeah.
my understanding they have a lot of in-house resources that you can use to learn.
Mhm.
Okay. All right. So during this rotation, did you encounter any specific challenges or unique situation that tested your pharmacy skills? We just talked about calculations. That's definitely got to test your pharmacy skills. But what else?
Yeah, in terms of research, the first task that the pharmacist gave me was to research things on methylene blue and how methylene blue works.
Mm-hmm.
So it's a very old drug and
Mm-hmm.
it's used a lot of times as a like a bioactive substance. It's like a blue dye,
Yes. Yes.
but in their case, they wanted to use it for things like Alzheimer's disease. So I did some research to look up how it could be used, its mechanism of action, its effect
Mm-hmm.
on reactive oxygen species, etc. And I created a handout for patients and doctor offices to see, okay, is this something that we can help provide
Uh-huh.
for their patients?
Uh-huh.
And in addition, when we
Uh-huh.
use it in the facility, how we can manage it. because it stains really well. It's a
It's
blue dye,
very
so they
blue.
want to
Yeah.
know how you clean it
Okay.
and all that. So
Okay.
that was pretty
Okay.
challenging, but we were able to figure something out for that.
Okay, well, pharmacy students on rotations, if you want to go to ScriptWorks and you need this handout from Ryan, let us know. We can share it with you.
Of
And
course.
that could probably help students counsel their patients. Did you get to do any counseling at all for patients, or was it mostly the pharmacist or a different team?
That's a great question. It was mostly the pharmacists. I think the reason is because it's an independent pharmacy, so I understand if they don't want to have a student in the
Mm-hmm.
front. I was able to sit down next to Bob when he was doing a consultation, so being able to see him be able to educate the patient on something that it's compounded that he made that he has faith in, and I know is going to be
Wow.
great for them
Yeah,
because a lot of times when you're coming to a compounding pharmacy, you've tried everything else, right?
absolutely.
And
Absolutely.
and there's and
Absolutely.
there's so many other things that it just hasn't worked, and you come to
Yeah.
Bob, and he
Yeah.
gets it done.
Yeah.
So that's
Oh
always really
man, yeah, I'm glad you bring this up because we compound agents that are not available on the market, or that are not available in the market in that specific formulations. Some patients may need different routes of administration, like rectally or transdermally, and those formulations are not available on the market. So, like you said, when they come to this pharmacy to get something that's been compounded, they've tried everything else, and it's kind of nice to see the pride in the pharmacist who's made it and now telling the patient how to use it and counseling the patient on the specific product. So that sounds like it was an amazing experience, an amazing thing for you to see as a pharmacy student, as far as the kind of impact that you can make in healthcare and in patients' lives, right? Um, so for listeners, for pharmacy students who may be getting ready to start rotations at ScriptWorks or any kind of compounding rotation, what advice would you give them? Maybe one of two or one or two, so they can um, take it and run with it.
sure. Um, First things I'll say are go with any rotation.
Okay.
Punctuality. Always
Okay.
got to be on time, and
Okay.
professionalism. That's
Yes.
always like the two big things that you need to
Yes.
do.
Yes.
Um,
Absolutely.
you're gonna need to brush up on your math skills because compounding
Mhm.
is a lot of math, a lot of conversions, and a
Yeah.
lot of um, actually weighing out medication. So just being able to like read a scale is
Ryan,
important.
did you use any resources for reviewing math, or is it just some people are just naturally good at it? I can't really think of any resource, but did
Um, so what I did to prep for the rotation
yeah.
was I reflected on my lectures
Okay.
from school. So a
Okay.
lot of the math lectures, Dr. Ellerby, he
Okay.
was my
Yes.
professor who did a
Yes.
lot of the math
Yes.
calculations, and I,
Hmm.
I think he
Right.
was yours as well.
Yeah, he was.
And
Yeah. Yes.
so
Yes.
I,
Yeah.
I reviewed that stuff. I
Okay.
also have a
That's what I
pharmacy
did too.
technician.
Mm-hmm. Mm-hmm.
Yeah, I have a pharmacy technician book as well that has a lot of math skills, so I was able to use that.
That's a good
Um,
idea. Okay.
yeah, so that has a lot of calculation
Okay.
questions to
Okay.
practice.
Yeah. Yeah.
Um,
Yeah. Yeah.
but
Okay.
being a lab assistant back in college, that's all I did.
Okay.
So
Okay. Okay.
so I
You
didn't need to
were ready
practice too
before even
much.
getting
I
to.
was ready. I was ready, but
Okay.
definitely still going in like I was still challenged a little bit, but there's always going to be a challenge as long as you think about the question and just answer it in a smart way or say, I'm not sure. Like don't guess. That's always important.
And you look it up. Yeah. Yeah. So
Look
you
it up.
did
Always look it up.
mention be professional, which is so important, so crucial. Um, Review your calculations. And I interrupted you at that point. Did you have any more?
My last thing was yeah, just research the pharmacy. Get to know the people there. Like
Mhm.
Bob's been a pharmacist there for all his life.
Wow.
Um,
This is
well,
someone
sorry,
who
that's
loves what he
he
does. It's his life.
he loves what he does. His dad was a pharmacist. He worked under his dad as a pharmacist. He worked at a pharmacy, and then he didn't like it, so he created his own, and he's doing
Wow.
very, very well at
Wow.
what he does.
Wow.
And he provides great patient care, not only for patients. I
Mm-hmm.
forgot to mention this earlier because in your question you mentioned What kind of adult patients do they serve? They serve pets too. It's not
Oh,
just it's not
yeah.
just patients. It's bunny
It's not just
rabbits,
human
it's
beings.
horses, it's
Oh, man.
dogs, it's cats. He's serving
Yes,
animals too.
yes, yes,
So so,
yes.
so that's something that's really cool about his
I'm
pharmacy.
so glad you brought that up because we always talk about pharmacists having an impact on healthcare and patients and human beings, but we do have pet patients too. Absolutely.
Pet
Absolutely.
patients matter.
Yes.
Yes.
Absolutely. Oh yeah, how can we forget about that? And yeah, there are not many medications FDA approved for pets on the market, right? So they do rely on this type of pharmacies to prepare their medications. I'm so glad you brought that up.
Yep.
That's a very unique, rotation site. That's a pharmacy setting that we don't talk about a lot. So I'm glad you were able to experience that. It's a really good opportunity as a pharmacy rotation. And I really appreciate you coming on and sharing your time with us and your experiences there. And I hope this helps anyone out there who's, has a compounding rotation lined up ahead of time. So before we wrap up, could you share a standout moment? You shared so many, a standout moment or patient interaction that left a lasting impression on you during that rotation. I mean, you've impressed me with the methylene blue, with the Wegovy, in clinical questions that you were trying to help the provider with helping pets get their medications.
Yeah.
But was there one like amazing one? More amazing, more impactful than anything we've talked about. And if this is it, that's okay because we've talked about a lot,
We have, we have.
a lot of good stuff.
There's one interaction that I was able to have where the I was in the pharmacy and I actually saw one of my old doctors who came in, and I was actually able to talk to her, Dr. Laura Timmerman. She helped provide. She did surgery on my right knee when I was 16. I had a football injury where I dislocated my knee,
Mm-hmm.
and it's been great ever since. She also actually helped my left knee because I had some injuries there playing basketball, but she knows it all.
You would have
So
been
being able to
crippled without
just
her.
I couldn't walk without her. So
Yes.
yeah, so
Yes.
just being
Oh
able to
man.
provide something for her. It wasn't for her specifically, it was for someone in her family, but being able to just provide some kind of service for her
Yes.
and give
Yes.
back to her
Yes.
because she's done
Yes.
so much for me. That was really impactful. I
Oh man, what a
love being able
beautiful
to
way
hear.
to wrap this up. Like, see how things come back full circle. She helped you with your health when you were younger, and now you find yourself on the other side helping her through helping a family member as a future pharmacist. And I mean, that's so rewarding, right? Those are experiences that really remind me of the joy that of the decision that I made to serve patients and to be a pharmacist. And what a beautiful, beautiful example. Um, Happy birthday, Ryan.
Thank you so much, Brigitte. I appreciate it.
You want me to sing? I
Do I want
went.
you to sing? No, 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 no. It's okay. It's okay. It's okay. They sang in the pharmacy on Friday, so like they got me
Yes, it's good.
and
Yeah.
Bernice like
Mm-hmm.
together, and so
Mm-hmm.
they sang Happy Birthday. We cut
Yeah.
the cake. It was
Yeah.
great.
Yeah.
But thank you.
Thank you so much, Ryan, for coming on. I think because of you now, someone out there is going to be a little better prepared for a
Mhm.
compounding rotation. And would it be okay if anyone reaches out to me and needs your contact, may I share it?
Of course, yeah. If you need
Right.
anything, you could reach out to Brigitte and she'll contact me and I can be that resource for them if they have any
Awesome.
questions.
Awesome. Look, there you have it. All right,
Mhm.
rookies. Thank you so much for tuning in and listening. And don't forget to like the video and share it and subscribe if you like it, of course. And until the next video, stay blessed. Have a good day. Bye-bye.